Hello, everyone. My name is Dr. Sean Field, and I'm the Director of Behavioral Services at Summit Point. We've been working to develop a series of videos that are meant to assist you in being aware of resources and supports that are available to you during these difficult times. Today, specifically, I want to talk about the fact that we have continued calls in our community to limit the amount of time we're engaging with other individuals and practicing social distancing. But it's important for us to realize that these strategies may not be possible for all the individuals in our communities, including those with developmental disabilities, those that have dependent care, or medically frail or compromised individuals. Assuring that individuals get these supports while also making sure that you and those that provide that care remain safe is really critical for us to be successful in assuring that individuals are safe and well taken care of during this time. When thinking about how to manage those risks, it really comes down to two major things: prevention education and preparation. As far as prevention education, what we're talking about here is assuring that you and your staff or those that help you in caring for individuals are aware of appropriate health and sanitary procedures, including washing their hands regularly, when they should wash their hands, such as after coughing, sneezing, handling any bodily fluids, touching surfaces around an area, an individual that we know is ill. Also being aware of how to do those procedures, knowing how long to wash your hands for, what materials you should be using to wash those hands, using resources and guides as far as having the correct soaps, the correct sanitizers available while you try to provide those supports. Please look down in the link below for resources that can help you in understanding, are these materials and these chemicals appropriate to achieve the outcomes which I'm hoping. As far as making sure you're prepared, it's important to think about, what will I do in case someone actually becomes ill that I care for? And the importance here is that you are setting up your plans and your approach to the situation now, as opposed to when it happens to you. So it's really important that you think about assuring that you have extra food and water in your home in the event that someone becomes ill. Assure that you have a working thermometer to take temperature readings, that you have a reasonable supply of medications for things like fever or cough. If you do, or the individuals you care for have prescriptions, make sure that refills are available or that you have a filled prescription. If you don't, reach out to your healthcare provider now to make sure that those resources are going to be available to you. If necessary, identify a space within your home that you'd be capable of quarantining someone, a place that you can assure that when you go in and out of, you can really emphasize your continued safety and healthcare procedures, such as washing your hands and disinfecting, to minimize the amount of risk you pose to other individuals by going in and out of those spaces. Have a backup plan designated for your family and for the individuals that provide care. Make sure that you reach out to the support network, that you have friends, family members, the community supports that are available, to know what you will do if you're unable to provide the care that you deliver every day, or if the individuals that assist you in doing that are also unable to provide those supports. Make sure that you have an emergency contact list available in your home that allows you to reach out to the people that you need at the time when it's most important. These include community resources, community health experts, your medical providers, and behavioral health providers that may be there to support your family when the time does come to respond to a situation in which an individual in your home may become ill. Also think about discussing with your employer, with your providers that you work with, and with your family and friends what your plan is, so that you have a clear path forward should someone in your home become ill. We hope this video was helpful in really giving you an idea of the things that you can do to move forward, assuring that your staff and yourself are properly educated on how to wash your hands and sanitize environments using the right materials, as well as preparing appropriately for the eventual situation in which you may find yourself having to care for someone that is ill, or you yourself becoming ill and having to seek care or support to help the individuals that you work with day in and day out. Thank you so much.